slight indentation on the right wall of the trachea there. Okay, so this is what is a right-sided aortic arch. Anything abnormal that you can see there? I'll give you a clue. Look at the ribs. Yes, when you see this additional thing here, this small one, see, normally, how do you differentiate between a cervical vertebra and a thoracic vertebra on an AP? The clue is, if this is a thoracic vertebra, its transverse process is always directed upwards and laterally. Can you appreciate this? Whereas this is a cervical vertebra, its spinous process is directed downwards and laterally. So cervical vertebra will have a transverse process directed downwards and laterally like this. Whereas a thoracic vertebra will have a transverse process directed upwards and laterally. So whenever you think there is a rib extra, look where it is arising from. See, this upwardly directed one is the thoracic vertebra. So the rib, this is the first rib which is arising from it. But look, this is the transverse process of a cervical vertebra. And there is a rib there, small bony rib. What is this? This is a left-sided bony cervical rib. Now the patient may have a complaint, may not have any clinical complaint. Cervical ribs are most commonly detected in an asymptomatic individual. We do a chest X-ray for some other reason, we see that there is a cervical rib, but we must mention that finding. It may lead to, thoracic inlet syndrome later on. Okay? So look at this radiograph. Can you see something abnormal? Again, look at the ribs. Can you appreciate that? Again, a bony left cervical rib there. So this is how cervical ribs are. Okay? Again, an incidental finding. Can you see something abnormal in this radiograph? What is abnormal? Yes. Look at the spine. Spine should be straight. What is this finding? Scoliosis. So scoliosis is described in terms of its convexity. So we will have to describe here. There is a scoliotic deformity involved in the thoracic spine with the convexity to the left in the upper thoracic region and a convexity to the right in the lower thoracic region. So that is how it will be applied. So they will give you a chest radiograph like this. Right? You will keep searching in the bones, lungs. There is nothing abnormal in the lungs. But presence of mind, if you look at this spine, you will be able to pick up the scoliosis there. Yes. Okay. This is something which is very difficult, maybe lesser known thing, but very specific, so you should know that. See, can you see a small projection here? And in fact, I don't know if it is not really projecting well here. There is a small line which is passing out here. It is not very well seen. There is a faint line here. Can you see that? Now this line, this is what is called as the azygous fissure and the azygous lobe of the right lung. This is an accessory fissure which is not normally seen. It is an accessory or a fissure present in very few individuals. Right? This fissure divides the right upper lobe into a separate azygous lobe. The point-in-point projection is one which is called the azygous vein at that point. Right? So this is sometimes what happens is that only the azygous lobe gets consolidated. Therefore, you can see a very sharp margin like this, which is diagnostic of azygous lobe consolidation. So it is not present in all individuals, only in a few patients that we can see, but very, very specific because it occurs only in the right upper zone. Okay, so this is what is azygous fissure and the azygous lobe. Oh, fine. Okay, leave aside the PA film. Just look at the lateral film. Three normal findings to be identified on the lateral film. One is retrosternal lucency. Can you see that? Yes, normal. Second is retrocardiac lucency. Normal, abnormal, normal. Lucency along the vertebral column. Is it increasing? Yes, normal. All three findings are normal. Then what is abnormal? Look at the sternum. Can you appreciate that the sternum is going in? It is going inside. Normally it should be straight. The sternum is going inside inside the chest like this, depressed sternum. This is what is called as pectus excavatum. The opposite of pectus excavatum is pectus perinatum. And the sternum bulges anteriorly outside, right? But here the sternum is going in. So what happens? Because the sternum goes in, what is located in the midline immediately behind the sternum? Heart, which is more on the left side, right? When the sternum goes in, the sternum pushes the heart more towards the left side. So on the near film, you cannot see the right heart border to the right of the sternum. So if I vanish these graphics, see there is no right heart border seen. Why? Because the heart has been displaced towards the left side. And plus they say there is a classic 7, like the number 7 shaped ribs which are seen, which is due to abnormal orientation of the ribs there. So this is what is seen in pectus excavatum. Okay, fine. Now,